First human West Nile virus case of 2025 confirmed in Hays County, Texas. Imagine the buzz of a mosquito, not just an annoyance, but a potential carrier of a serious illness. Hays County has just reported its first human case of West Nile virus for the 2025 mosquito season, marking a significant milestone that demands our attention. The Hays County Health Department confirmed this alarming news on Tuesday, highlighting the importance of vigilance during this time of year. But here's where it gets controversial. While many people might think of mosquitoes as mere pests, the reality is that they can transmit diseases like West Nile virus, which can have serious health implications. The county reports that 80% of people infected with West Nile virus may not experience any symptoms at all. However, the remaining 20% could face a range of unpleasant symptoms, including fever, headache, body aches, joint pain, vomiting, diarrhea, a skin rash on the torso, and swollen lymph nodes. And this is the part most people miss. The symptoms can vary widely, and some individuals might experience only mild discomfort, while others could face more severe health issues. West Nile virus is transmitted through the bite of an infected mosquito. These mosquitoes become infected when they feed on the blood of birds that carry the virus. It's a cycle that underscores the interconnectedness of our ecosystem and the importance of mosquito control measures. Hays County has reported that the Texas Department of State Health Services has not yet confirmed a positive mosquito pool in the county for the 2025 season. However, DSHS has identified 272 mosquito pools positive for West Nile virus across Texas this year. This discrepancy raises questions about the effectiveness of local mosquito control efforts and the need for continued monitoring. So, what do you think? Should more resources be allocated to mosquito control, or are current measures sufficient? Share your thoughts in the comments below, and let's spark a discussion on how we can better protect our communities from this silent threat. Hays County confirms first human case of West Nile virus. What you need to know. Imagine waking up with a fever, headache, and body aches, only to find out it could be West Nile virus. This isn't just a hypothetical scenario. Hays County has confirmed its first human case of West Nile virus this year. The Hays County Health Department, HCHD, announced the positive case on Tuesday, but due to privacy and confidentiality reasons, they won't be sharing any details about the patient. But here's where it gets controversial. Should health departments always prioritize patient privacy over public awareness? Let's dive in. West Nile virus, or WNV, is a disease transmitted through the bite of an infected mosquito. Mosquitoes become infected when they feed on the blood of infected birds. These infected mosquitoes can then pass the virus on to humans and animals. It's a cycle that can be hard to break, but understanding it is the first step in prevention. The good news is that 80% of people who contract WNV won't experience any symptoms. However, the remaining 20% may face a range of symptoms, including fever, headache, body aches, joint pain, vomiting, diarrhea, a skin rash on the torso, and swollen lymph nodes. If you or someone you know is experiencing these symptoms, it's crucial to seek medical attention promptly. And this is the part most people miss. Early intervention can make a significant difference in recovery. While the risk for severe symptoms is low, individuals aged 50 and older, as well as those with compromised immune systems, are at a higher risk. Severe WNV infections can lead to neurological complications, such as encephalitis and meningitis, which can cause stiffness, disorientation, coma, tremors, vision loss, paralysis, and in extremely rare cases, death. It's a stark reminder of why prevention is key. Unfortunately, there is no specific treatment for WNV. However, over-the-counter medicines can help alleviate symptoms. Patients typically experience symptoms for 3 to 6 days, but may feel fatigue and weakness for weeks or even months. It's a long road to recovery, but with the right care, it's manageable. For more information on WNV or how to prevent mosquito bites, visit the Hays County website. The site offers valuable resources and tips on mosquito surveillance and control. But let's not forget the bigger picture. How can we, as a community, work together to reduce the risk of mosquito-borne diseases? Share your thoughts and ideas in the comments below. Let's spark a conversation and find solutions together. West Nile virus detected in College Station mosquitoes. What you need to know. West Nile virus found in mosquitoes in College Station. In a concerning development, the Brazos County Health District, BCHD, has confirmed that a mosquito in College Station has tested positive for the West Nile virus, WNV, as of Monday. This finding is significant and raises awareness about the potential health risks associated with mosquito-borne diseases. Every year, from May through October, BCHD conducts thorough mosquito surveillance to monitor for various viruses, including West Nile virus, St. Louis encephalitis virus, and Eastern equine encephalitis virus. Dr. Dennis Nkaliki, the chief epidemiologist at BCHD, stated, "We've been doing a weekly report about mosquito trapping and testing, and this is the first time we have detected positive mosquito pools this year." This positive identification follows a recent human case of WNV reported earlier this month, marking the first instance in Texas for the year. It's crucial to understand that WNV is transmitted through mosquito bites rather than through direct human contact. In light of this positive test result, Dr. Nkaliki urged the community to remain calm but vigilant. It means we have to be aware that West Nile is a virus, and there's a need for us to actually protect ourselves and our community, he explained. While it is important to note that 70 to 80% of individuals infected with WNV do not exhibit symptoms, Dr. Nkaliki highlighted that common signs can include fever, headaches, body aches, joint pain, and in more severe cases, confusion or encephalitis, which is inflammation of the brain. Vulnerable populations, such as the elderly and those with weakened immune systems, face a higher risk of severe complications, including paralysis or even death. A statement from BCHD emphasized, "Please keep in mind that all of Brazos County should be considered positive for WNV, and residents should take the necessary steps to reduce exposure to mosquitoes." To minimize the risk of contracting WNV, Dr. Nkaliki recommended several preventive measures. Wear long sleeves and long pants when outdoors. Limit outdoor activities, especially during peak mosquito activity times. Utilize insect repellents that are registered with the EPA. Experts advise avoiding outdoor activities during dusk and dawn, as these are the times when mosquitoes are most active. Dr. Nkaliki noted, "Early hours of the morning, that's the dawn, and then early evenings, we see the dusk. Those periods are when mosquitoes are more prevalent and flying around." According to the Centers for Disease Control and Prevention, CDC, symptoms of WNV can manifest anywhere from 2 days to 2 weeks after being bitten by an infected mosquito. In response to the recent positive test, BCHD plans to enhance its surveillance efforts. Dr. Nkaliki added, "When we receive a positive poll case, we usually enhance our surveillance, such as spreading larvicide to the affected area and surrounding communities." What are your thoughts on the measures being taken to combat the spread of West Nile virus? Do you believe enough is being done to protect the community? Share your opinions in the comments below. Copyright 2025 KBTX. All rights reserved.